Hi, everybody. This is Dr. Nam Lee from Lee Acupuncture. I have here our special guest, Dr. Felice Gersh. Hi, Doc. How are you?
Hi, I'm great. So glad to join you.
Yeah, it's good to see you again. So, I know you're a really busy doctor. Your time is really valuable. So I'm gonna make a fast and then go ahead right away. So let me introduce who Dr. Gersh is. So Dr. Gersh here. Actually, I have her book. Really, you guys should actually have this book. So Dr. Felice Gersh is a award-winning physician with a dual board certifications in OBGYN and integrative medicine. She is a founder and the director of the Integrative Medical Group of Irvine. The practice provides a comprehensive healthcare for women by combining the best evidence-based therapies from conventional medicine, naturopathic, and holistic medicine. So she taught obstetrics and gynecology at the Keck USC School of Medicine for 12 years as an assistant clinical professor and received the Outstanding Volunteer Clinical Faculty Award. And she's also a prolific writer and a lecturer and has been featured in several films and documentary series, including The Real Skinny on Fat with the Naomi Willow and then Fasting. Welcome, Doc.
Oh, thank you. It's a joy to be with you.
I'm so glad you are in Orange County. Actually, you're internationally popular doctor, and then I really respect and then your specialty. So, can you tell us about your practice, doc?
Well, sure. It started way back in the 1980s as initially a conventional OBGYN practice, but very quickly I realized that in order to really address the needs of my patients, I needed to add more. So very quickly I added on a Chinese medicine practitioner, a psychologist, and a nutritionist, and a biofeedback specialist, and a massage therapist. So I really knew that I needed to do much more than just prescribe drugs and do surgeries. But it was after I stopped doing deliveries, and it's been a little over 10 years now, that I felt that I needed to do more myself. So I went back to school, did a 2-year fellowship in integrative medicine at the University of Arizona School of Medicine. And then I sort of revamped my practice. I had stopped doing obstetrics, and I really felt I needed to figure out what to do because just doing surgery was, I felt that's end stage disease care. I wanted to be more proactive. So I really revamped my practice, and I moved to a different office space. And in my new office, I have a beautiful big gym that also serves as a multi-purpose room where we do fitness assessments and exercise and group meetings, although not so much group meetings right now, but we were. And so I now specialize in an integrative approach, incorporating all the efficacious evidence-based lifestyle treatments, herbal medicine, mind-body medicine, massage, body work, all these different aspects to help all of my patients, who are predominantly women, though not exclusively, to really achieve what they want in life, which always requires optimizing health.
I see. Because I actually have a lot of patients from your practice, and then they said you are actually their primary doctor, but also you're a hormone specialist, and then you do a lot of women's health, and then infertility, which is our focus area of our practice at this time. So I truly appreciate helping, serving, and so many our patients. So do you, as the practitioner for this long time of practice, do you see any, like, let's say, the struggle for people specifically for fertility, like any biggest struggle you see?
Oh my goodness, yes. It's such a huge problem now. Now, it's always important to recognize that fertility involves the male and the female, and statistically, when there's an issue, a problem, it's 40% is a male problem, 40% is a female problem, and 20% is both. And that's just, statistics. And any individual couple, of course, it could be whatever. Now, we are seeing such an influx of women having problems with their menstrual cycles, which of course is going to translate into fertility problems. And our society hasn't really recognized that the menstrual cycle is a vital sign of women's health, and that fertility, and absolutely, and fertility itself is really a sign of health. In fact, ancient societies knew this. They worshiped fertility gods. And now we spend so much of our lives trying to squash our fertility that when women want to be able to have babies, often they're really struggling because their menstrual cycles, are really representative of their fertility status. So they're having menstrual cramps and PMS and irregular cycles and heavy cycles. And all of these things are really manifestations of nutritional deficiencies, chronic stress, circadian rhythm dysfunctions, and often other underlying conditions like polycystic ovary syndrome, like my book, and endometriosis and uterine fibroids and chronic vaginitis and such, because the vaginal tissues have really been taking a beating, with having altered microbiomes and all these problems that are coming about. So we really need to work on, even if a woman needs to have extra help, like advanced fertility technologies and so forth, they need to really be optimal in their health before they even try to conceive. Because we now know that pregnancy complications, which are just also astronomically increasing, the C-section rate is through the roof. And, women are having dysfunctional labors and they're going into preterm labor, abruptions, preeclampsia, maternal mortality is increasing. And this also is why it's so important to optimize fertility and health status of women before they conceive, and as well the male, because we now know that the quality of the sperm has an impact on what happens in the pregnancy, and of course, the long-term life of the child that is being created. We know that it's so, so important. And this is not really being addressed in many fertility centers. They just immediately say, okay, we're going to do IVF. And it's like, here's a woman who's unhealthy and you need, but they don't want to delay. They don't want to you're like, oh, well, let's work on your health for 3 months. It's not happening. They're just immediately going right in. So this is really where I do everything in my power to get women to really explore what their health status is really like, their lifestyle, and of course, the partner, and then work in every which way I can to get all of these factors optimized. And then I say, okay, now let's try to let you get pregnant.
Exactly. So I think the combined, especially our matured age group of patient, they should be more mindful and then prepare, and then if something they need help and then go to ART. But I think I should combine all this together, and then that's what absolutely I think a role for at this time integrative medicine. So since your book is a PCOS and you are hormone specialist and then PCOS specialist, when I read this book, and I guess it's your daughter, and then you wrote with your daughter together. Oh, how sweet. So I want to go over a little briefly about the PCOS. And I saw you actually posting yesterday. You had some posting about Instagram about the hormone and PCOS. And what is a PCOS, doc, by the way?
So the words that make up PCOS is polycystic ovary syndrome, which tells you nothing about what's really going on. It's really a foundational dysfunction involving metabolism that stems from ovarian malproduction of estrogen. And this is not well understood, that estrogen is really the master of metabolic homeostasis. It actually regulates every metabolic function. That is what nature intended, to coordinate all of the functions with health, which is metabolism, the creation, storage, distribution, and so forth of energy, and the link to reproductive functions. And estrogen is like the glue that puts it all together and keeps it all working properly, because nature wants a healthy woman to be fertile and to be pregnant, because it really takes a lot. We talk about pregnancy now as the ultimate stress test of a woman's health. And if you fail pregnancy because you can't get pregnant, or you have pregnancy related complications, it means that that's a sign of future problems with your health because you actually did poorly through this really what is a stressful time for a woman's body. And that's why nature puts it all together. It's not like reproduction is an added on feature, like you can just take it or leave it like fancy hubcaps or something. No, it's like more like the transmission. It's really essential for the functioning of the body. And in women with PCOS, the conversion of testosterone, which is produced in the ovaries, into estradiol, the dominant estrogen that's produced by the ovary, is not functioning properly. And so you get this buildup of testosterone like an assembly line, it's not moving down the assembly line. So you get this clog up of overproduced testosterone, and then you don't have enough of your estrogen. And so basically, without enough estrogen, it's like going into sort of a variation of menopause, which we know when women don't have hormones in menopause, that all the metabolic dysfunctions like high blood pressure and atherosclerosis and mood disorders and gut problems and cancers, all these things increase in women after menopause. Well, all these things happen at an earlier age in women with PCOS, and that is, of course, no good. And in addition, on top of that, what's magnifying it, because these are like very mild issues in women who are otherwise eating the right diet and living the right lifestyle, but now it's magnified because of the ubiquitous presence of endocrine disruptors, chemicals that alter the very function of our hormones. Dominant is estrogen, but we know it's even more complex. There's probably interference with the function of testosterone and melatonin, and a lot of different hormones are messed up in terms of the receptor function. Now we have data that shows that all hormones work through a receptor, and the receptors for estrogen are basically malfunctioning. Just like in diabetes, the receptor for insulin is malfunctioning, and that leads to diabetes. In women with PCOS, the estrogen receptors, as well as others, are malfunctioning. So it's like a double whammy. You don't make enough estrogen, you make too much testosterone, and then the hormone receptors are not working properly. So it's like even like you have less, because it doesn't matter how many hormones you have circulating if the receptors aren't receiving them and then functioning properly, because hormones are messengers. They deliver information to the cells, so the cells will know what to do. So women with PCOS have a lot of metabolic problems. They have weight problems like 80%. And even the women who don't have a weight problem, they still have metabolic problems. And we know that they tend to create more visceral fat, the belly fat, even if it's invisible. They have more inflammation. Their immune systems are dysregulated. Then the gut microbiome is dysregulated. And the blood vessels are not making enough nitric oxide, which is important for vascular health. That's why they have higher rates of preeclampsia, pregnancy-induced hypertension, diabetes, gestational diabetes, and so on, because they don't have proper functioning of their insulin and glucose regulation systems either, which is also regulated by estrogen. A lot of people don't know that estrogen also regulates the mitochondria, the energy fat-burning factories of the cells. So women with PCOS are not so good at burning fat, but they're very good at making fat. It's a different skill set. So women with PCOS have a wide array of reproductive problems, period problems, and so forth, pregnancy-related complications, and metabolic problems. And it's just so body-wide. It's a global body problem. And because it's kind of complex, because it involves virtually every organ system potentially, because estrogen has receptors on every organ, it's like over the top, because our medical system is so broken down into organ systems that when you have a problem that spans all the organ systems and all the issues of the body, it sort of belongs to no one. So poor patients go from doctor to doctor, and they get piecemeal care and often suppressive symptom treatment as opposed to healing treatment, which is, there's a value in reducing symptoms, but not if that's the sole approach, because it's like you have a wall full of termites and you just cover it with wallpaper. It may look pretty and you can ignore it, but eventually the whole place is going to fall down. So the day of reckoning will always come if all you do is try to suppress symptoms and ignore what's really going on under the surface. So that's, in a nutshell, a lot about a very complex and highly prevalent, I mean, it's just an epidemic now worldwide of PCOS.
Exactly. Isn't that it is like a number one main reason of people infertility is a PCOS,
That's right.
isn't it?
It's number one. You got
And then
it.
also in your book said it's your personal story as well. So you had your own
Yeah.
struggle with the PCOS. Probably you really understand well. That's another topic I have to ask about what should we do with this? Because I think we can get more information. So briefly, let me ask about how do you use like a holistic approach like acupuncture? Because you said you use herbal medicine, but
Sure.
how you use acupuncture for your general like your population like infertility or women's health and PCOS?
Well, happily, there actually is a fair amount of research, which I love, supporting the benefits of acupuncture. And, we're learning more about the actual underlying scientific mechanisms, but we do know that acupuncture can help with many of the issues. Like it can help regulate menstrual cycles, help women to ovulate and get regular cycles, which is amazing. It can help with menstrual cramps, PMS, like pretty much every menstrual problem can have some benefit from acupuncture, which is phenomenal because everything is about risk-benefit ratio. You look at every drug, and if anyone watches television, they see such a wide array of potential side effects. But with acupuncture, they're just not there, like what is going to happen, So that's the beauty of it. You get benefits with like pretty much, no significant side effects or risk. So it can help with mood, it can help with pain, it can help with cycle regulation, the flow itself. So it's amazing as an adjunct. And so it's wonderful. Now in my area, almost every IVF center is incorporating acupuncture. So, which is phenomenal. So, and it's wonderful that there have been actual studies published because we always want to show that it's real evidence-based medicine, of course, and we have that. So it's a wonderful adjunct to pretty much, you can name it, but certainly in terms of women's health, it can help with, young-aged women, reproductive age women, women going through menopause, helping with sleep and mood. And so all of these different aspects of health, gut problems, which are very prevalent, by the way, in women with PCOS, they have high rates of irritable bowel syndrome, acid reflux, a lot of similar problems that women have in menopause. And acupuncture can be beneficial there as well.
Very true. We see every day, every day. So can you tell us about how our patient can find you and your practice?
Well, I am actually in an office. That's why it's not my studio. This is just actually an exam room. That's why it's a little, not a beautiful studio, but that's my life, is actually seeing patients. But fortunately, I can also do telemedicine. But for my practice, it's called Integrative Medical Group of Irvine. And it's in, of course, Irvine, Southern California, Orange County, where I see patients every day. I'm in the office, and as well, like I said, I do telemedicine. And so in terms of finding me, it's Integrative Medical Group of Irvine, and also you can easily Google me and find me. I am doing also, like you're doing your program, I have an Instagram live show that I do on a regular basis, although I don't exactly, and I'm hoping to get more of a set time schedule, but it's hard with my schedule of seeing patients, but I do usually at least like one show a week. And so my Instagram handle is Dr. period, and it has a period in there, Dr. period Felice Gersh. And so hopefully people can sign up and watch my Instagrams, and they're also archived on my YouTube channel. So, and then of course, I love that you mentioned my book because I'm so proud of it. Amazon #1 bestseller. And I have another one out since that, one that came out like almost a year ago, and that's called PCOS SOS Fertility Fast Track. And it's a 3-month blow by blow of how to try to optimize your health in just 3 months to improve your fertility for people who really want to rush and get going. And, it's like I say, give me 3 months, I'll give you a healthier body. And, so that's, and then I have hopefully more coming. It's just my daughter, who is my co-writer and also my pusher, she pushes me. You got to get this done. I need you to proofread this and work on this with me. But as we are in this COVID pandemic, she's been homeschooling because of the schooling. So I'm a little bit slower, but stay tuned. More books coming out.
Lovely. Great work. Great work. So admire, inspirational. Thank you so much.